Hoping everyone can still hear me on the phone. My name is Damon Haycock. I'm the Finance and Research Officer here at the Silver State Health Insurance Exchange. We will also be known as the Nevada Health Link. That is our consumer forward-facing name, and that's where most of those folks that you will be dealing with will be going to our Nevada Health Link website, our Nevada Health Link web portal, and enrolling folks in insurance. Today, we're going to be going over the exchange overview. We're going to discuss the single streamline application, some guidelines, roles, and responsibilities, shop and compare, working with the other types of assisters, the navigators and enrollment assisters, and the difference between how they are paid, so you guys get an understanding of those other folks that are going to be working out there in that environment. And then we're going to talk briefly about broker of record and list billing. So here in a couple minutes, our Executive Director, John Haeger, will be coming out and addressing everyone. So everyone knows these sessions will be, or are currently being recorded, and they will be broadcast again on YouTube. So if you have any colleagues that fail to participate but want this information, it'll be sent out on our broker listserv, and it will also be out on our brokers and agents webpage at exchange.nv.gov. Under our resources tab, there's a brokers and agents page where we will keep all our up-to-date information on there. We have an up-to-date question and answer document. So as you guys ask questions of us, as long as they're not the same question someone else has already asked and been answered, we will go ahead and post those so other folks can get on and see what questions have been asked and answered, so we don't spend too much time. I'm going to go over the presentation. We're going to do 5 sessions. So 4 of them already on our website already have topics. The 5th session, we're looking at getting a marketing and advertising session presented by our communications officer. So you all know how we're going to be announcing to the public through our opportunities where we discuss how they need to, if they request any side-by-side assistance with an individual, that we will also be pointing them every time that we announce that, not only to our navigators and enrollment assisters, but to brokers and agents as well. So we want to make sure that that process is another opportunity for you all to be successful. Before I go into it too much, obviously we're not going to take roll. Our intent is here in the next week or so, we're going to post a document that is basically an intent for brokers and agents to participate on the exchange. The reason why we're going to do that is because we need to know on our 4-hour block of mandatory training if we need to set up 1 day or 15 days, depending on how many people want to participate. Later this week, maybe next week, there's supposed to be a release of information on the carriers participating on the exchange. And so therefore, if you already have appointments with those carriers, or you want to get appointments with those carriers, we want to make sure that we wait till that announcement comes out before we send out that intent notice for you all to fill out. So that way, if you don't have appointments with those carriers and have no desire to be appointed with them, then you won't tell us that you have an intent to participate and then pull that intent later, so we can develop that training appropriately. I'm going to go ahead and start because of our brief amount of time. I'm hoping that we are going to get through this material rather quickly and then provide you an ample opportunity to ask questions. I ask that you allow us to go through this presentation because it's being recorded for others, and that we will save all questions to the end. So write your questions down, and I will attempt to get this done no later than 11:30 to go through this information. These seminars are posted a week ahead of time. We'll be posting the 2nd seminar for next week here this afternoon. And so if you have specific questions about this information, we would request that you send us an email to that brokers and agents at exchange.nv.gov. And that way we can actually have answers prepared for your questions if we have research or any other discussions with other entities, to go ahead and answer those at the end of the session. I think today we have one that we're going to answer. To my right here, your left here in the room, is Steve Taylor. And Steve is part of the Xerox team that is contracted to operate our web portal. He is my right-hand man as far as the brokers and agents onboarding team. And so if you receive any correspondence, it'll either be coming from him or from myself, and he's going to be managing the questions and answers section, as well as doing a lot of great work on these seminar presentations. We may end up adding more to the team as we move forward, but we're trying to get out as much information as possible for you all to make a decision to participate and for you to be successful. I don't know what others have said, and we had a summit in June where there was a lot of questions from brokers and agents about what is our process, and as we go through it over the next 4 or 5 weeks, that should become a lot more clear. But I want to set the stage at the beginning, right off the bat. We are confident and we are secure in the knowledge that we know that the brokers and agents in the state of Nevada and who are licensed to offer health insurance in Nevada will inevitably be the success factor for our exchange. And so we're not looking at this as an add-on, as we need to grab these folks. It is these folks are going to ensure that we have satisfied customers coming back to the exchange enrolled in the right plans for them and their families. And so if that message in any way, shape, or form has not been portrayed to the broker and agent community, let me be the first to tell you that we need you for us to be successful, and that we believe it is critical that you are successful for us to succeed. With that in mind, I'm going to go ahead and start with the actual presentation. Again, our executive director may come in and interrupt me to give his words of wisdom. But we're going to go ahead and start on the first, or I guess it would be the second page of the presentation. So today we're going to talk a little bit about the overview. If you already have this information, my apologies, but we want to get it out to those that don't. Obviously, the Affordable Care Act was passed in 2010, and that there is an individual mandate for all individuals in the nation to purchase health insurance. It requires everyone to have it by 2014. There are some exceptions. We'll go over that later. But for the most part, everyone is required to purchase health insurance, or they will end up paying a tax penalty. As part of the Affordable Care Act, there are the establishment of exchanges across nationwide, different types of operations. You have the federally facilitated exchange, which is now called marketplaces. So it's the federally facilitated marketplace. There is the state partnership marketplace, and then there is the state-based exchange, or the state-based marketplace, which Nevada is one of. We are operating our own state-based marketplace. To participate in exchanges per the ACA, you need to have an individual needs to be a citizen or a national, or be lawfully present. They also cannot be incarcerated unless they are awaiting disposition, and they need to be a resident or intend to reside in the service area of the exchange. And so those are the three factors of how an individual is going to be able to participate and hopefully receive some form of financial assistance to get health insurance. Our initial open enrollment begins October 1st of this year, and this year is different because we have a 6-month open enrollment per the Affordable Care Act. It will go through March 31st of 2014, and the future open enrollments will be October 15th through December 7th. And before I go on, I'd like to introduce our Executive Director, John Haeger, who will briefly address you here.
Hello. Thanks for attending.
That's it. Wow, that's a good one. All right. So we're going to move on to the goals of the exchange. All of this is on our website. So if you ever need to reference it or want to know what frames a lot of the decisions that we are making, not only with brokers and agents, but with all entities that are participating and various stakeholders. We want to increase the number of insured persons in Nevada. There is, depending on who you talk to, between 550 and 600,000 uninsured individuals here in our state. And so per the Affordable Care Act, our plan is to try to insure as many of them as possible. Through that end, we're going to facilitate the purchase and sale of health insurance. We want to assist qualified employers in enrolling health insurance for their employees, as well as help individuals with their subsidies. We're going to provide consumer education. I don't know if you've seen, we've already started our marketing campaign. We're on the radio. We're in various websites. I've seen different banners, and I think we've even started our TV ads as well. Again, we want to assist residents of Nevada with access to various programs to help them pay for their health insurance. Those premium assistance tax credits and cost sharing reductions. We will go over those in detail later at another session. So then we have the guidelines, roles, and responsibilities. This is taken from our operational plan for navigators, enrollment assisters, certified application counselors, and brokers and agents. As I said earlier, and I want to frame this again and really make this hit hard and hit home, insurance brokers and agents will play a critical role for Nevada Health Link and the online marketplace. You guys will be able to enroll individuals, families, and employers in health plans offered on the Nevada Health Link and will be compensated by the carrier to do so. The brokers and agents, of course, we feel will be the leaders of the insured population. we'll discuss a little bit more about compensation later. We also have, continuing on the guidelines, roles, and responsibilities, that brokers and agents are responsible to make sure that they're appointed with all of the carriers offering qualified health plans on Nevada Health Link if you want to sell those products, to be able to sell anything and everything that is going to be available on our web portal. The payment of commissions will be governed by the agreement between the broker and agent and the carrier, as it is today. We are not going to set up a specific payment plan from the Nevada Health Link to brokers and agents to help incentivize signing up folks for insurance through your current contacts and contracts. We will transmit your national producer number to the carrier with each enrollment file. So when an individual enrolls in health insurance on Nevada Health Link, they will then effectuate payment, and once that payment is effectuated, we will send over 2 files to the carrier. One, of course, is the payment file, and the other file is an enrollment file. And that enrollment file will have your national producer number on it. And so the carrier will know immediately that it is your national producer number. You, as that broker or agent, are responsible for that enrollment, and then we anticipate that carrier will pay you based on your current agreement with them, or potentially modified agreement in the future. So as I said earlier, the carrier will pay commissions, not the Nevada Health Link. Continuing on to guidelines, roles, and responsibilities on that 3rd page, licensed brokers and agents will be required to attend a brief training course on the use of Nevada Health Link's web portal. We did receive a lot of questions on does this seminar or these series of seminars count towards that training? It does not. This is more an exposure to the exchange. It's to help present information for brokers and agents to make a decision if they would like to participate in our new marketplace and how they go about doing it, what are the various business rules of our agency. There will still need to be an orientation session where we will help set up all brokers and agents through the web portal, sign on, how to manipulate the various functions that are set up specifically for brokers and agents to manage all of their accounts, how to sign folks up through the health insurance marketplace, and then, of course, a brief discussion on Medicaid and CHIP and the other functions of the exchange. It'll take approximately 4 hours, and as I mentioned, I think I just went over darn near all of it. The only other thing, of course, we'll discuss in a future session, and we'll also do this at that orientation, is how the APTC, or the Advanced Premium Tax Credits and cost sharing reductions, apply to those plans, and how you'll be able to sell those to your prospective clients. You'll also need to, of course, you'll have to sign off on the privacy and security agreement, and as well as an operating agreement. And so we are requiring that 4-hour training be done in person. We have a twofold reason. One, that we're going to identity proof you on the spot, and we're going to look you up in the Nevada Division of Insurance's system to make sure that you're still licensed and in good standing through their CERCON lookup. And then we're going to issue you a Nevada Health Link card with your picture on it and your name. So if anyone wants to know, are you appointed with the exchange, you can say yes, and you can show them proper identification. So as of today, that is our current process moving forward. Continuing on, what are the expectations of brokers and agents? Brokers and agents will manage the exchange clients on the exchange website portal. So you will be able to run your proposals, do sales, enrollment, premium payment tracking, and service issues. I recently received a presentation from our web portal vendor on what a lot of those screens are going to look like. We're going to go over it, make sure that it is exactly what we want to present, and then I'll be posting that to our website. I'll send it out on the listserv. If we have time through one of these sessions, we can actually walk through it, but it'll be a series of screenshots, and you'll be able to see basically how you're going to be able to operate on the exchange. Sorry I did not have that available for this session to begin with, but we just got it, I think, late yesterday. Yes. Continuing on, so the Affordable Care Act requires that there's a single streamlined application. They do not want to have different folks applying for different subsidies and public assistance utilizing different formats. They wanted a single access, no wrong door approach. And so it's an intuitive, streamlined application for health insurance enrollment and renewal. Hopefully, and I can't promise you that we can do this, we're going to try to find a way to set up a specific demo for brokers and agents, or invite you to attend one of our normally scheduled demos so you can see how that information is entered and how intuitive the program works. So as an example, If an individual makes $250,000 a year and has no issues with verifying their information, and they enter that information in, it will bypass a lot of the other questions and go right to shop and compare. And so based on how that single streamlined application is filled out will determine how many of those questions an individual will see. Unfortunately, on the mailed out paper application, it's the whole thing. But as far as the web portal, it basically responds to each question that is asked. So if you don't enter in any dependents, you will not need to go to that whole dependent demographic information. This single streamlined application was developed with Medicaid, a number of pre-application steering questions, and a streamlined application for benefits because, as I mentioned, there is one application to apply for health insurance, whether it be a qualified health plan on the exchange or a public assistance program, Medicaid, and our children's health insurance program, our CHIP program, which is known as Nevada Checkup here in the state. And so individuals may not know what they qualify for, so they'll be entering those information, or you'll be helping them enter in that information. And then that application will come back and it will ask if they want help paying for health insurance. And that's the trigger. That's the important trigger, because without clicking on, do you want help paying for health insurance, it's going to move right into shop and compare. But by clicking on that, it's going to then do an eligibility determination for public assistance programs, for the advanced premium tax credit if they appear to qualify for cost sharing reductions. Again, we'll get into more of that later in another session when we go over all of those types of subsidies. But that's the trigger that if you walk away with anything today and you plan on selling on the exchange, know that you want to check that box for folks that make in a certain range of income, so that way you can get them the best deal as possible. The single application for benefits will collect information to determine eligibility, as I mentioned, for all programs, tax credits, and cost sharing.
One thing to note, your commissions are for enrollment in a qualified health plan through a commercial carrier. You do not get commissions for Medicaid or CHIP. So just to be real clear about that. And so then you say, well, why should I even do that? The idea, though, is somebody comes to you expecting to get commercial insurance. You say, hey, actually, you're eligible for Medicaid or CHIP. When their income increases and they're no longer eligible for Medicaid or CHIP, and they will very likely come back to you for help to enroll in a qualified health plan. So it's basically, from the way I would view it, as an investment in the future. You're taking that time to help somebody, and they will likely come back to you later when they can afford, or when they are not eligible for Medicaid and have to go into a qualified health plan.
Yes, and additionally, when that individual or family leaves and you've successfully helped them enroll in public assistance, they may know of other people that they can refer you to that are either in the same situation or in a higher income bracket that can benefit from your commission sales. And finally, don't forget that there will have families that will have multiple different options. So one of the parents may be qualified for a qualified health plan with a subsidy that you will then sell an insurance product for and receive a commission. And then perhaps we'll say the mother is pregnant and qualifies for Medicaid, and the two children qualify for CHIP. And so by turning that client away, you're also turning away that potential qualified health plan for, we'll say, the father in that four-person situation. So just keep that in your head as you're trying to determine what book of business you're going to be offering. I'm not going to go too much over the actual process flow, but we put it in there for you so you can see that an individual with child here will apply through the exchange, and that our eligibility engine, wow, I'm off today, is going to then determine what they qualify for. And as I just kind of explained there, the parent could be in a commercial coverage, the child or children may be in CHIP, and finally then it'll go to shop and compare. And so each of those individuals will have a different set of plans that are available to them, even though they're applying as one family. So they'll be able to click on the various members of their family, and it'll say, okay, these children qualify for CHIP, or the mother qualifies for Medicaid, and the father qualifies for these qualified health plans within this service area. And so it's very intuitive, and it will display all of those options that are in the service area of the family that is requesting coverage. Moving on to shop and compare. Again, as said earlier, we are going to have a web portal. It's a side-by-side shopping scenario. It's a farmer's market for health insurance. You'll be able to select and enroll in health insurance for your clients. One of the things that we are doing, and I think only 2 other states are doing it, Rhode Island is trying to, I don't know if they finalized their billing process, but Washington State has. They're going to be doing billing. One of the things that our exchange is going to do, different than most other exchanges in the nation, is that we are going to aggregate billing. So taking that 4-person example that I just gave, the father is on a commercial qualified health plan, the mother's on Medicaid, the 2 children are on CHIP, that family will receive 1 bill from the exchange. 1 bill for the premiums for the qualified health plan and the premiums for CHIP, the very reduced premiums. And so they will receive 1 bill that they can write 1 check or do 1 ACH transfer or any of the other types of payment methods that we allow to pay for health insurance, and they'll be able to send that into the exchange, and then the exchange will divert those funds to where they need to go and satisfy the carrier, satisfy Medicaid, satisfy CHIP. And so that's one of the things that we do. We will aggregate premiums. And of course, through that shop and compare, we'll determine eligibility for public assistance programs, individual tax credits, and cost sharing reductions. Those will actually be applied on that shop and compare screen, which is the next one on our slide. So I know it's kind of far for those sitting in this room. Hopefully those that are on the phone have this in front of them. This was a screenshot that we utilized at our summit, and it shows what our current setup is for shop and compare. You'll notice at the top there's a series of slides. One is primary care office visits, emergency room office visits, specialist office visits, and then off to the right there are how many generic drugs or brand drugs do you anticipate taking. It's kind of small here in the room, and I apologize, but underneath there's also estimate your costs based on expected costs. There's 2 preloaded scenarios, one for pregnancy and one for type 2 diabetes. And so what you'll want to do when helping an individual determine what's the best plan for them is not just compare, obviously, premiums, as I'm sure you guys don't do today. You compare the whole benefit package, but you will want to utilize these tools to help them determine what their out-of-pocket expenses are going to be. So they may decide later they want to have a higher premium but have lower out-of-pocket for what their planned expenses are for the year. And then you'll see different health plans. So on the bottom of the page, we have it's called Plan C down there, but you'll see that there was a box to the right that says premium, and then the next box has a subsidy of 0. So these folks don't qualify for a subsidy. But if there was a subsidy, an advanced premium tax credit, it would reduce that number, and you'd see that you pay going down. And so you'll see how much of the subsidy is applied. Granted, this is if they apply 100% of their subsidy, and that individuals and families are not required to utilize all of their advanced premium tax credit. And there are some benefits to not doing that, which we'll go over in next session. Also, you'll see here that it shows it's kind of grayed out here on the screen here, but on the actual presentation, there's a star system. So the exchange is going to be utilizing 2 sets of star systems. One is the accreditation, current NCQA or URAC accreditation star system based on HEDIS and CAPS data that show basically how well these plans are rated from those organizations. And then we're going to have a customer service rating as well. So as our questionnaires go out, our surveys go out, and they respond to them, we'll be able to aggregate those responses and develop what the customer score is for each of the plans. So they'll be able to see that as they're picking those plans specifically. You'll see that there's annual out-of-pocket costs, deductibles, because what office visits are, prescriptions, what the specialist costs. And so there'll be a series of these in a vertical layout of the different plans that are in their service area. They'll be able to click on that compare button that's at the top left of each of these plans, and then it will actually show each of the plans in a compare side-by-side basis. And if you've ever had fun and wanted to go look at a new car from one of the local car dealerships, and you start putting different models up on your screen, you can see, well, this one has this situation or this type of amenity, and this one does not, and you can shop and compare. And so on the next slide, this is what it's going to basically look like as far as showing the 3 different plans for shop and compare. So you can see, how much is the deductibles, and we break it out for the dental essential health benefits. What is the annual out-of-pocket? What is for drug benefits? And it's a series of different comparable categories. So when they look and want to determine what is the best plan for themselves, or you're helping these folks determine what's the best plan, you'll be able to use this as a tool to help you. Now, working with navigators and enrollment assisters, the Act requires exchanges to establish a navigator program. And so in good faith, we have done so. Navigators and enrollment assisters will facilitate enrollment in qualified health plans offered by the exchange. They are being funded by grants provided by the exchange. Although I want to clarify that the enrollment assister program is federally funded, and those federal funds end December 31st, 2014. So that program will go away. The Navigator program cannot be federally funded. It has to be funded by the operational costs or the operational funding of the exchange, and so we will be paying those entities directly. On our website, on our exchange.nv.gov, on our resources tab, there is an actual webpage for navigators and enrollment assisters and certified application counselors. If you have any questions or you want to go do some late night reading when you can't fall asleep or whatever the situation is, we have an entire section dedicated to those folks. We've awarded sub-grants, and we're finalizing that process with those entities. And we anticipate that the broker and agent community will want to work with those navigators and enrollment assisters because there's certain functions that brokers and agents can do that navigators cannot. As we all know, if there is an individual that gets enrolled and they have a claim problem, they were told that the plan covered X, Y, and Z, a certain cost, and they're getting a bill from the hospital, they're getting a bill from a provider, and that bill does not seem to jive with what they were told. It's my understanding, please someone correct me if I'm wrong, that the broker and agent community will often receive those calls and will coordinate that situation between the carrier, the provider, and the individual to try to get to the bottom of what the issue is and help with that process. So there's that added layer of customer service that our navigators and enrollment assisters not only will not be qualified to do, but are not required to, nor are we asking them to perform claims type of issues to help those customers out. Just so everyone is clear, we are required to train our navigators, and throughout the last session, if you were paying attention to Assembly Bill 425 from the Nevada Division of Insurance, they established the certification for exchange enrollment facilitators. And they call them exchange enrollment facilitators because the certification is exactly the same for a navigator, an enrollment facilitator, or excuse me, an enrollment assister, and a certified application counselor. And the basic differences between them for certification standards is how they're being paid. Navigators do outreach and education and enroll people. Enrollment assisters specifically enroll people side by side with them. And then there are certified application counselors, and I think a good example of these are those folks in the hospital that are there when an uninsured individual goes through the emergency room, and then they get pulled aside after they've been stabilized and that everything is okay. They pull those folks aside and say, hey, we're kind of interested in getting paid next time. That's not really the message they give, but we'd like to get paid next time, so let's see if we can qualify you for health insurance. And so the ACA recognized that there are folks that will see those people. There's also folks in the community and community health centers that are also dealing with people that come in to have an issue that is unrelated to health insurance, but then you find out that they have some ailment or some concern that they and their children aren't covered, and so they're able to then certify those folks to enroll people into those programs. We anticipate the bulk of those programs that certified application counselors will enroll people in our Medicaid chip because of the nature of the program. But the certification, as you'll see, is very similar to the producer certification for Nevada. There are each exchange enrollment facilitator must participate in a 20-hour pre-certification course and pass that. They must pass the certification exam, which is put on by the Division of Insurance's contracted vendor, Pearson VUE, the same place that producers go, at the same level. So anyone, if there's any question whatsoever, the pre-certification course has to be passed at a 70%, and a certification exam has to be passed at an 80%. And even though the federal government has allowed a lower passing score, we wanted to keep the playing field level between brokers, agents, and exchange enrollment facilitators. There also must be an application with the Division of Insurance, similar to what producers go through today. And then the Division of Insurance, once all that information is received, will then provide a certification. And then those folks will come over and, again, like you all, will participate in a 4-hour training program to be oriented, to have an orientation to our web portal, and to go over some other final issues, ACA issues, or new business rules that the exchange has developed since then. And then we will appoint them as in the exchange as an exchange enrollment facilitator. So very similar to brokers and agents, they have to go through the same type of training. You should all see very soon in the next 2 weeks an emergency regulation put out by the Nevada Division of Insurance that addresses the regulation on certifying those exchange enrollment facilitators, and all of this will be outlined even further there. And we're almost to the end. Broker of record and list billing. So initially, we came up with a business rule that said that the individual will put in the broker of record, and the last broker of record on that account is that broker of record for the remainder of the plan year. However, we were quickly educated on the other roles of brokers and agents, in that it made more sense to allow those individuals and employers to change that broker of record if they, in order for you all to get your commissions for providing continued customer service to someone that maybe you didn't sign up, but now you are taking under your wing and you're assisting. That exact process on how we're going to allow that broker of record change is being finalized. We should have that finalized next month. We're not in a major hurry, only because you can't have anybody pay for health insurance and enroll in health insurance. Really, they don't start their coverage until January 1. So we have an amazing amount of work left to do between now and October, but it's not that we haven't forgotten about it. But we are moving forward with doing a broker of record change throughout the plan year. So that way you don't have to turn away people. If a broker signed someone up and then left the state, how would you be able to grab that client? But we also want to provide safeguards or ensure that the market is competitive and that we're not robbing clients from each other. And so we have to work out those issues. We've already talked to some carriers, and they've submitted some of their broker of record changes. If you have any suggestions, I'm going to get flooded with 300 emails, but if you have any suggestions, please send them to the brokers and agents at exchange.nv.gov on what you feel is appropriate, because as we did with the carriers, we want this process to be a team-based approach with brokers and agents. So I know right now it feels like I'm talking at you because I'm trying to get a lot of information out so you can ask questions. However, this process and a lot of the business rules that we develop here at the exchange are a team-based approach, not only with our sister agencies in the federal government, but with our stakeholders, our carriers, and now with our brokers and agents. And so your opinions and your input matter, and we value them, and you'll help us set up an exchange that we all want to be a part of for years to come.
Now, just to be clear, we've had brokers participating in the creation of the exchange all the way back since March of last year when we created our advisory committee. So we've had broker input along the way. You guys haven't been completely left out. It's just that the people in this room may have been left out because they haven't been with those advisory committees. So we've been trying to make sure that we bring at least representatives from the various communities. But yes, if you see something that's wrong, let us know. This isn't our Nevada Health Link. This is your Nevada Health Link. So again, it's a team effort.
And then list billing. This is something that is near and dear to our executive director's heart. He wanted the ability to mirror what the federal government has authorized tribes to do. So individual tribe members on the individual market can be, for lack of a better term, supplemented on their premiums from a tribe. A tribe can send in funds to supplement their premiums. And so John had a great idea. Why don't we do something that is similar to list billing? So if an employer is not mandated to provide health insurance for their employees, and as we all know, no employer is mandated to provide health insurance for their employees until 2015, that employer may still want to offer some form of incentive to his or her employees, not only with a multitude of ways. They can, of course, pay them more and tell them go on the individual exchange. They can pay them the same and say good luck and go on the exchange. Or they may want to contribute, but they really can't afford the 50% contribution rate to participate on our Small Business Health Options Program, our SHOP marketplace, but they want to contribute 20%, or they want to contribute $100 per employee. And so we wanted a way for them to be able to help out individuals pay for their health insurance, to help them retain their good talent, and to do goodwill to help them pay for insurance. So the idea is to set up a form of list billing where we would basically receive the funding from the employer first, and then we would reduce the amount of the bill to the individual. The individual is ultimately responsible for their bill, and so if the employer failed to send a payment, the full bill would go out to the individual, or if they didn't meet it in the time frame, the full bill would still go out, and then if the employer paid later, we would then do a short pay bill the next time. We would reduce it, net pay for the remainder of the premium. All of this stuff, though, is looking at a post-October 1st, 2013 implementation, but it's something that, as you talk with employers in this state or out of state that have employees here in Nevada, that may interest them to participate or to assist folks, their employees, either on the exchange or off. I don't think they're going to do list billing off, though.
Well, yeah, it'd be up to somebody else to do list billing off. But on the exchange, so you may not have an employer may not want to pay anything toward the insurance, but they offer the opportunity to do a payroll deduction. I like that idea because I'm much more likely to get the payment. It makes it easier for the consumer. They don't have to think about it, and it's perceived as a benefit offered by the employer. So everybody kind of wins on that, even though the employer may not provide any kind of subsidy. Now, to be clear, if it's in the individual market, which the list billing we're talking about individual market, all the normal tax rules apply. So an individual plan cannot be integrated with the Section 125 plan. So therefore, the deductions would be post-tax, and any payments that are made by the employer would have to be imputed income. So you have to realize those issues, and until the Department of Labor changes their rules again. That's the way it's got to be for now. And to be very clear, we view the individual bills as an individual responsibility. So when we generate the bill on the 10th, if we have not received and processed the payment from the employer, we're going to send a bill out to the individual saying that they owe the full amount of whatever it is. So let's say a payment is $1,000, they get a tax credit of $800, the remaining is $200. If the employer paid the $200 before the 10th of the month, then the bill would go out the door saying that the employer paid $200, you owe $0. If the employer didn't pay anything, then it would show, the employer paid $0, you owe $200. Because again, it's the individual responsibility, and the reason why we think that is so important is because of the issues with the advanced premium tax credit and how all those rules go. So it's a little bit different from a list billing function, where I think the true list billing function is the employer pays the insurer on the due date of the bill, or all the way up to the due date of the bill. In this case, the bills are due on the 25th, but to show up on that bill as processed, we need it by the 10th of the month. So it pushes it out a little bit, but it provides additional functionality. We think that's very important for all of you guys, because you go to an employer today, you say, hey, sign up for health insurance. They say, great, how much is it? You say it's $1,000 a month. They say, holy cow, I can't afford that, right? Well, going forward in the future, you say it's $1,000 a month to, so let's say the 50% contribution based on the number of employees that you have. They say, holy cow, I can't afford that. You say, well, don't go anywhere. Let me have access to your individual employees. They're guaranteed issue. We can get them through the web portal. I can even do a list billing function here or whatever we want to end up calling this, to help you deduct it from their pay. You don't have to pay anything, but if you really want to, you can pay some money toward it. So that allows the employer to contribute potentially. It allows you to grab employers that you would otherwise not get all in one place. And so we think that this is a good deal for you guys. We hope that you guys like it. Unfortunately, it won't be available October 1st. We still got to work out some of the kinks on that, so we're looking at closer to a January implementation, but still a good possibility. And remember that the first open enrollment goes all the way through March 31st. So hopefully we'll be able to make this work for you, and you guys will be pleased with it.
So before I open it up for questions, first of all, a little protocol. We're going to open it up to the room, then the phone, then the room, then the phone, then the room, then the phone. Everyone has an opportunity. And second, please forgive me if some of my answers or the answers from the people up here are going to be, that will be covered in next session, or that will be covered in week 3, because we don't want to spend a whole lot of time answering stuff that we know we're going to give you a full-blown presentation on. It is not something that we're trying to be disrespectful. We just want to make sure that we give the time that is necessary to fully explain some of these answers, and it could take us 5 minutes to answer a question that we're going to go over in 5 minutes on a later session. So with that in mind, I'm going to turn it over to Athena if you'll put them in question and answer mode on the phone, and I will open it up. Oh, before I do, I apologize. We had one question, right?
There's one question.
So the question was,
will a broker agent be required to be contracted with all insurance companies offering plans on the exchange, or just the ones we currently contract with?
And so the answer is brokers and agents aren't required to contract with anyone. If they want to sell products on the exchange and receive a commission, they need to be contracted with those entities that are offering plans on the exchange. You don't have to contract with every carrier, but if you don't contract with every carrier, when you bring up Shop and Compare, you may see a plan that is your carrier's current plan, and you are going to have to talk your way into selling that plan to that customer. It may behoove you, we're not recommending or suggesting, but it may behoove the broker agent community to entertain the idea of contracting with the various carriers on the exchange.
You probably already are.
You probably already are, but we want to make sure that we answered that one. So that was the one submitted one we had for this.
The one that you may not be with right now is a co-op. Everybody knows co-op's coming, right? So you might have to work with the co-op to get appointed by them. But more than likely, we can't say who the other carriers are, but more than likely you're already appointed by them.
So we're going to go ahead and we have about 15 minutes left, so I apologize for going a little bit over. We have a question here, I saw a hand.
So in terms of navigating the actual web portal, will there be a place where we can access like evidence of coverage and summary of benefit documents?
So the requirement for all plans to be certified on the exchange is that they have a way to access those specific documents. And I believe, and Shane can correct me if I'm wrong here, this is, go ahead. Announce yourself, Shane.
I'm Shane Drugo. I'm lead implementation project manager for Xerox and largely focused on carrier onboarding.
So I believe that we are requiring that all carriers have a link from their plans to their evidences of coverage and summary of benefits. So that way you'll be able to navigate to those to get knowledgeable on those specific plans and be able to point folks to different parts of those plans.
So on the presentation on page 12, you see the compare plans. Mm-hmm. Those data elements are basically the summary plan description. That 8-page, the feds have said it has to be 8 pages now, or 4 pages front and back, right? Those data elements are basically in that compare plans option there. The evidence of coverage, there will be a link to their evidence of coverage.
90-page EOC that goes through
150
whatever.
Yeah, somewhere in here. I'm not sure exactly where.
All right. Do we have one on the phone, Athena?
Please stand by. This conference is being recorded. Only the main conference is recorded.
Okay. What's the question?
We'll go ahead and take another one in the room.
He was first.
Oh, sorry, John.
When do you think the actual rates are going to be posted? When will you have an idea?
So we anticipate the Nevada Division of Insurance releasing the proposed rates from the carriers in the next few weeks. The final rates based on Assembly Bill 425 cannot be released until 30 days prior to open enrollment, so September 1st.
Our understanding, whatever proposed rates are released, they will basically be sample rates for certain tiers. You're not going to see all the rates, but there'll be a sample.
But a ballpark idea what they're going to do.
It'll give you an idea, exactly. I'll get you in a second. Hey, we got any? Athena Cox works here. She's John's assistant, and I can't tie my shoes without her. So I'm glad she's here working the technology.
To place all participants in talk mode, press 1. To begin a question and answer session, press 2. To begin, your conference is now in question and answer mode. To summon each question, press 1, then 0. Each question will be asked in the order it was received. You have 7 questions remaining.
Go ahead and send on through.
When are we going to define large and small businesses, their responsibilities? Until 2015?
So I'm going to ask you a question in response. Are you talking about the employer mandate, or are you talking about what the state of Nevada has determined the difference between large and small groups? What is the threshold? What specific question are you asking, sir?
Both.
Both. Okay, so Nevada has determined what the small group market is, which is under or 50 and under. 50 and under. It's really isn't it 1 to 50?
Yeah, it's 1 to 50 through 2014 and 2015. It increases up to 100 in 2016 by federal law.
Correct.
And then the employer mandate is a penalty for any employer with 50 or more full-time equivalent employees. So there is some overlap in the small group and employer penalty groups, but that penalty has been delayed. According to the IRS, about 3 weeks ago, they said that they're not going to enforce it until 2015. So there's no reason to worry about that right now.
And we're going to go over that next session on the the employer mandate. So I have a few slides on that we'll go over next time. Let's take just another one from the phone, and then we'll get back to you, sir.
You have 10 questions remaining.
Hello?
Go ahead. Go ahead, please ask your question.
Yeah, my question is, will we have the capability to post a link to the exchange that would then enable someone who came online via that site to enroll and have our producer number flow through? Or would that person always have to select our producer number from the drop down?
It's not even, no to both. So the Exchange web portal is a standalone system. So if you develop a link that points to our web portal, you'll be leaving whatever place you develop that link from, and you'll be going right into our web portal, and everything will need to start from the beginning. Because it is a single streamlined application, we need everyone to have the same no wrong door, equal access approach to our web portal. As far as a drop down for national producer number, I don't believe we are setting up I think it's going to be something that gets manually entered. Will it be a drop down, Shane?
For primary care selection, you mean?
No, for national.
That's what they had indicated at the summit.
So there's a couple of issues. This is John. Trying to create an electronic communication system with outside web portals was too much to add to our current project. And so the board back last summer basically said we're not going to do any kind of web-based broker entity. And that's basically what you're asking for is somehow you've created a link or you've moved somebody to the health link and they are automatically attached to your account so that you get the credit for it.
Right.
I'm not sure about the individual side whether somebody can enter a national producer number, but what I do know is that you can start an application by logging into your system as a broker and going through the broker web portal. You can start an application for an individual, and then at that point, your producer number is attached to that application, and then that person could go in and go to the individual, do an individual login and complete the application, and your national producer number would be attached to it at that point.
And so we are looking for post-implementation. We're going to be going back and looking at web-based brokers and that connectivity, but it's not something that we can have ready by open enrollment this year.
Thanks.
Question in the room.
Yeah, sorry. So actually 2 questions. One's a real short one relative to the question I was just asked. So let's say I have a prospect. They decide that they want to enroll in a plan in the exchange. I go and enter the national producer number and get the thing started. But let's say the guy's at his house or whatever and we're on the phone. Can I email them a link once I've done that allows them to complete the process?
So yes, you can, but if you can actually go through, and correct me if I'm wrong, but you can actually go through the entire enrollment process through your account. So if you have that individual sitting next to you, you can enter that information and it'll pick up your national producer number, and you're going to go through the process and walk them through side by side how you're going to do it, or maybe you're doing it on the phone. Or
that's what I'm talking about.
So you can either do it. So you log in as a broker on the web portal. It's an individual, employer, and brokers, right? You log in to the broker side of that. You can start the application. You can complete that with them, or you can stop it and hey, you've got something else you need to do, or he has something he needs to do. Hey, I'll get back to it. Is there a place I can go? You email them about a health link, and they create their login. They've got an application in the system, and they can go forward on their own. Because you started the application, your producer number is attached to that application at that point. Now, if they were to go to another broker after you, then certainly that broker, it would be whoever is last in that enrollment process. So you need to be aware of that. But there's some of those issues today, anyways, right?
So it's going to identify that they've already got something started in the system, and it's going to pull them up when they try to go in there.
When they enter in their demographic information, it'll say there's an account that exists already.
Okay. So my other question that I had from before was, so we estimate that there's 550 to 600,000 uninsured people in Nevada. And obviously the exchange is trying to get as many of those people enrolled as possible. Question, as far as research, any idea in terms of the percentage of that's expected to be Medicaid?
Yes, so we expect, I believe it's 300,000 of those, 350,000 of those folks will be Medicaid qualified based on more than half, based on the expansion of Medicaid. And so we are going to have, I think it's around 240, 270. I'd have to look it up and get it back to you. But those are some ballpark figures.
Got it.
So there is this market that nobody has tapped yet that is pretty significant, that is going to be able to receive a tax subsidy or a tax subsidy or some cost sharing reductions that isn't on someone's book of business right now. So there's for the dedicated individual that wants to go out and make money, they can sincerely increase their book of business because no one's helping these people right now, or they tried to help them and then
it's just too much.
It was too much. So there's going to be some opportunities. Let's get another one on the phone.
You have 8 questions remaining.
Hi, this is another broker commission related question. If we have 2 brokers together in an office and they work closely together, will we have the ability on the exchange to do a commission split?
I don't believe at this time we have multiple fields for national producer numbers. So the answer today is no. There will be one national producer number transmitted over on our electronic file for that enrollment. And as we determine the process for updating that broker of record, then the account owner, the individual or employer, will be able to go in and update that broker of record. And we're going to iron out all the exact processes next month.
Is that something to entertain down the road? Because today we can do that.
We'll write it down on our list.
Well, yes, we'll look at the possibility of implementing that after open enrollment.
Maybe the carrier.
Let's take another one here in the room. Oh, were you up, sir? I'm sorry.
I think you should.
Okay.
No, that's fine.
Go ahead.
There's a moment in the process of immigration in which people are in a limbo situation. They are not undocumented, but they are not necessarily yet completely processed. Is there a provision as to how it's going to be for those people that cannot prove they are legal in this country, but they are certainly not undocumented either?
And so the research that I've done on lawful presence is that if an individual is going through the process to become lawfully present or a foreign national, that all the information that I've seen speaks to the immigration judge being able to provide information to the exchanges nationwide that say this person is in the process of becoming lawfully present. And so that becomes a potential appealable issue, and we'll talk about appeals later. But that is the only thing that I've seen as far as is what you do. And the research that I performed was based on when someone appeals lawful presence, and where the appeal can be upheld based on information from an immigration judge. And so I don't think that rule has been finalized yet, but I know that they are considering that at the federal level. Let's take another one on the phone.
You have 6 questions remaining.
Go ahead and ask your question. Do we have anyone on the phone? Let's take it in the red here.
You have 5 questions remaining.
Hi.
Oh, sorry. Go
Hi,
ahead
can you
on
hear
the
me?
phone. Yes, we can hear you. Go ahead. I'm sorry.
Okay. I have 2 questions. The first one is regarding the tax penalty. So the open enrollment period is between October 1st and March 31st. When does the tax penalty actually apply? Is it for individuals who don't have coverage after March 31st or after December 31st?
So the individual mandate requires that all individuals have health insurance. They're allowed some breaks, no more than 90 days. And so with this first open enrollment period, as long as they are enrolled in insurance by April 1st and they do not let their insurance lapse, then technically they meet that individual mandate. However, there is a discussion, we learned this at our summit from Jackson Hewitt, that they're going to look at when, if it's at the end of the year that they have a lapse, and then they have a lapse at the beginning of the next year, that they're not going to, or that they are going to penalize individuals because they have a 6-month lapse. And so it didn't have insurance October, November, December of 2013, and they don't get insurance January, February, March. If they apply that rule for the tax penalty, then they would actually have to pay their individual mandate for the first 3 months of the calendar year. We have not seen where that has led, where that has actually been finalized. I don't anticipate that being seeing that the open enrollment period goes for 6 months. I can't imagine that the federal government would penalize you for getting insurance April instead of January. Then why didn't they just shorten the open enrollment period to end in December? But we still have to wait to see what the IRS is going to do on that process.
Okay. The second question I have is, so in the state of Nevada, you guys require 4 hours of training in person. Do you know if this is required in other states like California or Arizona?
So we do not know what the other training requirements are for other states. I do know that there is required training that is being offered as an online basis for the federally facilitated marketplaces. They are doing a different form of identity proofing and identity validation. At this point in time, we do not know what other states are doing for their brokers and agents.
But there are some some of them have very significant training requirements. I know for like the navigators, there are 30, 40-hour training courses. I think Maryland has a 110-hour training course. So interesting to see the differences between the states. I'm not sure about the brokers, but I think that most of them are requiring training. I just don't know how much.
And so I'm going to take, because I cut this gentleman off here in the room, I'm going to take one more question in the room. And it's not that I don't want to take any other questions, but we have a time frame to stick by. Please, those that are on the phone that still have questions and those in the room that still have questions, please submit them to our brokers and agents at exchange.nv.gov, and we will add them to the questions and answers, and we will send out that information. We will update our consolidated Q&A. And to help this process a little bit easier next week at our next session, please review the session that we send out, the link to it, and please review that information and send us your questions ahead of time so we can have answers really quickly for you at the end of our session. But I'll take the gentleman here in the rig as I cut you off.
Also was related to the training. You said that the initial training is going to be no charge for it out of the testing.
So here's I want to separate the training into two sections. There is the sessions we're doing now, which some people are referring to training, but we're not calling it training. And this is more of an orientation to the exchange. Then there will be a 4-hour block of training, which we are not charging brokers and agents to participate in, for them to come to us and receive that information, receive that appointment with the exchange. We are not actually charging brokers and agents to do that.
And there's no testing portion.
There's no testing portion on it. You're just you're going to come. There is, and I will say this, there is the potential development for a broker and agent specific training program that one of the vendors here in the state is developing right now. And we have to look at that program to see if that's an appropriate program to ensure that the brokers and agents know the new rules. But at this time, there's not going to be a test at the end of the 4-hour.
Yeah, I must have misunderstood you then through the presentation. I thought you'd mentioned something about a test they have.
So for exchange enrollment facilitators, they have to follow all of the same training requirements as producers do to become certified with the Division of Insurance. And so there's a pre-certification test they have to pass. There's a certification test they have to pass. That's not for you guys. You guys, as long as you're licensed and in good standing in Nevada, you have a certification through the Division of Insurance and appointments with your carriers. You have passed all the legal requirements to sell insurance. on the exchange except that last 4-hour block that we need you to show up so we can make sure that you are comfortable, that you understand the broker portal, and that we give you some other information on some of the nuances of the Affordable Care Medicaid.
Will there be an annual recertification like there is with Medicare?
So we are entertaining annual recertification. If we need to do an annual orientation, I hate to use the word certification because you get certified with a division of insurance, you get appointed by the exchange, and those semantics are very important. But we are looking at if there's significant changes to the market, significant changes to the law, significant changes to our business rules, yes, we're going to need you to come back, or we may develop some online system so that way you can go through that process so you are educated on what you're going to be selling that next year. But because we don't know, because rules keep coming out every other week from the feds, we don't know what's going to change. I hate to lock you in one way or the other as to what's going to be required for next year. With that, I want to thank all of you for participating, those on the phone. I will try to get through the presentation even faster next week so that way we have more time for questions and answers. But please feel free to explode my email and send me your questions so that we can provide you the appropriate answers.
You'll need a bigger inbox.
I know. And again, you may get an answer that says, please see the answer in the consolidated Q&A, because I'm hoping everybody will go there first, look at those answers, look at those questions, and that way they can get instant gratification on an answer that we've already determined. Please sign up for our listserv if you're not already on it. I am no longer going to blast emails out to all the broker community, broker and agent community. Not only am I not doing it for efficiency, I can't anymore. It's not allowed. But every part of our communication will be through that listserv, through that brokers and agents at exchange.nv.gov. And please keep looking at our website so you'll see different things that get posted to help you along this process. And we appreciate you all showing up today.
All right. Thank you.